Good afternoon, and thank you for joining us for our Cancer Conversation series brought to you by UNC Lineberger Comprehensive Cancer Center. My name is Megan Carlson, and I will be your moderator today. Today's presentation will be on cancer myths and facts. This will be presented by Trudy Tatton-Howard. Trudy is an oncology nurse navigator at the NC Cancer Hospital. She is working with cancer patients with gastrointestinal cancers, and she will tell you more about that. Trudy brings a wealth of experience and a real passion for working with our patients, and we're so happy to have her with us today. Without any further ado, I'd love to turn it over to Trudy.
Thank you so much, Megan. I'm so happy to be here today to talk to you about some of the myths that surround cancer. So as Megan mentioned, I work in the Cancer Center here at UNC, and I'm what's called an oncology nurse navigator. I work in the outpatient setting, and we see patients almost every day who have been diagnosed with cancer and come to us for treatment options and for us to answer some of their questions as they go on their journey towards curing their cancer, treating their cancer. And the types of cancer that we treat in our clinics are colorectal cancer, stomach cancer, pancreatic cancer, and esophageal cancer. I work with a group of surgeons who specialize on operating on those types of cancer. So today I've been asked to talk to everybody about some myths that are often perceived as being fact. And so we're just going to talk about some of the facts that surround cancer today. So the first thing I want to talk to you about is what is cancer, and then we'll address the myths, and then we'll talk of some of the risk factors and some of the things we can do in our everyday life to reduce our risk of cancer. Okay, so first of all, what is cancer? So cancer is actually a term used to describe a group of diseases. And basically what happens is that a normal cell kind of loses its mind and starts to multiply and divide without stopping, and it invades the surrounding tissues and organs. Okay? One of the myths I often get asked in clinic is, does cancer thrive on sugar? So when patients come to us and they're talking about their cancer and kind of what they can do, best practices and what they can do with their diet, they often talk about sugar. And many people have read that cancer thrives on sugar, and it's actually not true. So eating a large amount of sugar won't make your cancer grow faster. It won't make it spread. All cells need sugar in order to survive. So many times what will happen is patients have read this and they decide that they are going to cut sugar out of their diet altogether. So we had a patient recently who was diagnosed with prostate cancer. And he had read a lot in the literature about diet and cancer, and so he had gone on an extremely strict diet. He'd cut out many foods, he'd cut out most sugars, and he had lost a lot of weight in a very, very short period of time. So this is something that we really don't want to see. We want patients to eat healthy, balanced diets. We want them to maintain a healthy weight, because you need a very good diet, you need very good nutrition in order to fight the cancer and to go through your treatment and feel very good. All right, so here is another conception that people have about cancer. People feel like, well, if I think positively, it will cure my cancer, it will prevent it from spreading, and it will prevent it from coming back. So of course, positive thinking, positive attitude in life is a very good practice to uphold. So, but we must also keep in mind that it's difficult to always have a perfect positive attitude every day, all day. People who have been diagnosed with cancer will often feel fearful, sadness, and kind of discouraged about their diagnosis. Having a positive attitude and having a positive outlook is wonderful, and we can do that by having family and friends, having close relationship with them, practicing relaxation techniques, of course exercising, staying active in our community, and having a good balanced diet. Those are all things that can contribute to a very good quality of life and a good outlook on life. But that said, sometimes it's hard to have a positive attitude all the time, and sometimes we might put some undue pressure on our loved ones who are going through cancer. It's a lot of pressure to always be positive and always be happy, every minute of the day. Okay, so I hear a lot about this, about the hair dyes and the antiperspirants. So not to worry, you don't have to go gray if you don't want to. Hair dyes have not been found to cause cancer. That said, people who work with a lot of chemicals and hair dyes, like hairdressers and barbers, there has been some research to suggest that they have a higher incidence of bladder cancer. Antiperspirants. So there has been some things in the literature about aluminum chlorohydrate, which is an ingredient that's found in some antiperspirants and deodorants. Now, up to date, there has been no proof that using these antiperspirants that have the aluminum in them can cause breast tissue changes that might lead to cancer. But I will say this, that if you are worried about the aluminum that's contained in these products, there are many ones out there that do not have it in. So just kind of look at the ingredients when you're shopping for your deodorants or antiperspirants. Okay, cell phones. So I remember hearing this on the radio when I was driving to work one day, and I thought, oh my goodness, we are all in a lot of trouble because I don't even have a landline anymore. So my goodness, so does using your cell phone cause cancer? And I believe that it was brain cancer that it claimed. So no, there's not enough evidence in the literature to suggest that using your cell phone can cause cancer. And in fact, the energy that is released from cell phones is a low energy waves, and it, like in televisions, and it is not considered to be harmful. Though I love this slide here. It kind of reminds me of my teenagers who are constantly on the phone, using their cell phones constantly. Okay. So we are asked this question a lot in our clinic because I do work with a group of surgeons, and patients are coming to us to talk to us about their treatment, which often includes being operated on or having a biopsy. So no, when cancer is operated on and it's exposed to air, there has been no evidence to suggest that exposing cancer cells to air will cause it to spread in the body. And surgery is actually one of the most effective ways of treating most cancers. Okay, so can you be too old to be treated for cancer? So no, you can be treated at any age for cancer. And in fact, the average age of a diagnosis of cancer is 66 years old, and 25% of people between the ages of 65 and 74 are being diagnosed with cancer. When you meet with your doctor and you've been diagnosed with cancer, he or she will discuss with you your options and discuss any pre-existing health conditions that kind of affect your care and will modify your treatment. And Jimmy Carter actually was treated for metastatic melanoma, and he successfully, in his 90s, he received immunotherapy. Okay, so is cancer a death sentence? So the good news is that since the 1990s, the chance of dying of cancer has really significantly decreased. There have been so many advances in radiation therapy, in chemotherapy, in surgical techniques, that people's ability to survive and be cured of cancer have increased significantly. And in fact, the 5-year survival rate for prostate cancer, breast cancer, and thyroid cancer are now over 90%, which is very promising. And a lot of people don't realize that 4 out of 10 cancers can actually be prevented through lifestyle changes, which brings about some very interesting things that we can talk about. What you can do today to affect your chances of developing cancer. So the first one is a big one, smoking. Smoking is a big risk factor for lung cancer among many other cancers. So if you smoke, you need to seek help from your doctor with suggestions about stopping smoking. And then also I mean other tobacco products like chewing tobacco and snuff. And this includes cigars as well and cigarillos that you should quit as well. A lot of times people don't think about secondhand smoke. Exposure to people around you that are also smoking can be a big risk factor as well. Okay, the next one is your weight. So obesity can be a risk for many different types of cancer. So if you're overweight, you need to talk with your doctor about ways that you can lose some weight. Exercise, eating healthy, eating a balanced diet that's low in fat, rich with vegetables and fruits. So we all need to strive to do that in our lives. The other thing is exposure to the sun. So if you're out in the sun a lot, you need to use sunscreen. And also you need to reapply. We all are oftentimes very, very good at applying the sunscreen, but we don't reapply as the day goes on. So we get kind of busy in the yard, washing the car, out with the kids at the pool or at the beach, especially in this area of the country. And so you need to remember to reapply. And really, SPF 30 is a good SPF to use. Alcohol. So you want to limit your alcohol use. So for women, it's a glass of wine a day, and for men, 1 to 2 glasses of wine per day. Okay, and we all want to exercise regularly. So a lot of people feel like, oh, I don't have enough time in my day to exercise. But if you break it down, if perhaps you took a 5 or 10 minute walk in the morning, at lunchtime, in the afternoon, or perhaps in the evening. I know I try to park my car far away from the grocery store or the mall, and to kind of get some extra steps in. And also at the mall, if you want to kind of walk all around the mall, take a little detour, you don't know what kind of, good bargains you'll find. But these are little things that you can kind of like adopt in your day to kind of increase your activity level. So it's very doable. You don't have to run on the treadmill for an hour at a time, but if you try in your life to kind of increase your activity level as much as you can. Another thing that you can do is use the stairs instead of the elevator. So go up a flight of stairs, down a flight of stairs whenever you can. Those are really good little helpful hints to increase the amount of steps that you have in your day to help increase your activity level. Okay, so resources. So when you are being treated for cancer, or you've been recently diagnosed with cancer, you probably have a lot of questions. So these are some websites that we recommend that have a lot of information that's very easy to understand. Cancer.net, Medline Plus are excellent websites to go to find out more about your diagnosis, or perhaps a diagnosis of a loved one or a family member, to get a little bit more information.
Well, thank you, Trudy, for that wonderful presentation. That was fantastic. I really do feel like I learned a lot of what I thought was true maybe wasn't.
Yes, and there are a lot of misconceptions out there, and unfortunately the fear is of many doctors and nurses, people that are taking care of patients, is that it can cause a lot of unnecessary worry when you believe something that you've kind of always thought to be true, and really is not true and not based on fact. And as well, the worry of many doctors is that people kind of put off going to the doctor because they have some of these beliefs, and kind of prevents them from getting their care, getting into the doctor sooner,
right.
Because they're they have these beliefs, and it's kind of preventing them from kind of getting answers to their questions from the actual doctors and nurses.
Right, and I hear a lot of times that these myths often are passed down through communities, maybe through your family. This is something that you heard from your grandma, so it sort of stays with you, and that becomes inherently what you believe is true. So often it's with these resources that we mentioned, and with the facts that Trudy mentioned, just about spreading that knowledge as much as we can, so that people are able to get the care they need without being prevented from certain things.
Yes, that's very true, and I know a lot of there's a lot of myths out there,
right.
That we didn't talk about today
Yes.
that you should look up, because a lot of people, I remember when we started using the sweeteners, there was a lot of talk about the saccharin or the aspartame in these products that could cause cancer, and that as well is not true. And a lot of people have that feeling that they don't even know where they heard it from.
Right. It couldn't tell you exactly which email, maybe which post on social media, which is something that nowadays we tend to see a lot of myths going around, because it's so easy to share and to go viral, as they say. So it can be disseminated or spread a lot faster.
That's right.
Yeah.
I think the cell phone one too,
right.
as people, talked about that a lot, especially in this day and age, the things that we're using, chemicals and the cell phones and things like that. I think it kind of gets talked about a lot, and it can be kind of misleading.
Yeah, and I don't think it's a bad idea to take a little bit of a break from your phone.
Yes.
Every now and then. Even though that myth wasn't proven to be true, putting down your cell phone, putting it away from your pillow. Maybe at night, I hear of some people that sleep with it under their pillow, which could be a fire hazard, right?
Yes,
so
they do get really warm.
Yes,
that's for sure.
Yes, so keeping that a little bit away from you, taking a cell phone break, disconnecting from technology is something that I think everyone could use as well. So thank you so much. And we did have a few questions that came in, if you wouldn't mind answering them. So, and if you have any questions about the presentation today, we do have an email that is cc@med.unc.edu. It should be on your screen right there. So if there's anything that comes to mind, or maybe you think of something next week, feel free to send those questions to that email. We do our best to get back to you, and we'll have an expert answer that for you. So it's a cool tool that we have. But the first question that I hear a lot of confusion about are the terms palliative care and hospice care. I hear that people think that they're interchangeable. So is that true, or what is your take on that?
So palliative care and hospice care are two separate things.
Okay.
So palliative care is a special area of medicine where doctors and nurses help take care of people who have a serious illness.
Okay.
So they help manage the symptoms, and they address, along with curative, along with treatments to help cure and treat their disease, also treating the pain, nausea, things like that, anxiety, signs and symptoms that come along with that. And hospice care is a special area of medicine that treats patients who have been diagnosed with a disease or a cancer where their prognosis is about 6 months or a little shorter. And that sort of care involves helping patients be comfortable and to manage the symptoms that they're experiencing, often pain, anxiety, nausea, things like that. And so that's kind of the difference between the two.
Okay. And it does sound like both of them really do aim to provide comfort to the individual, just in different capacities.
Yeah, they are both palliative. Anybody that has gone through a serious illness, has had a loved one be diagnosed with cancer and pass away, knows those two disciplines of medicine are excellent there. Those doctors and nurses, caregivers, are so incredibly skilled at helping patients.
Right.
And there's amazing advances out there in medicines and therapies that really help.
That's awesome. Well, thank you for answering that. So our next question, and I heard you touch a little bit on alcohol, and you hear all the time, well, if you're having a glass of red wine, then it's almost better or preferred to other forms of alcohol. Now, is that true or what?
I have read that too. There's a substance in red wine that was thought maybe to help prevent cancer.
Resveratrol.
Yes.
One of those compounds.
I'm glad she said that. So no, it has not been proven. So it does not matter if it's red wine or white wine, but we do recommend that it's just that you limit your alcohol use,
right,
because it has been found to increase your risk of some cancers.
Right.
Breast cancer has been talked a lot about. So yes, so it does not matter about the red wine versus white wine.
Right.
Other
so it's not an excuse.
Beverages.
Yes.
No.
Okay.
No.
Good to know. And another one that we hear so often, you just mentioned breast cancer, and we associate that strictly with women.
Mm-hmm.
But is it true that men can also get breast cancer?
That is true.
Okay.
And we do have patients that in clinic right now who are gentlemen that are being treated, and men do have breast tissue.
Right.
So yes, it is not very common, but it absolutely does happen.
Okay.
Yeah.
Okay, great. And then our last question, if you don't mind. So we talked about the things that we could do to prevent cancer. So if I eat right, I avoid the sun, I'm exercising like I should be, does this mean that I'm doing everything that I should and I won't get cancer?
So all those things are excellent. Excellent practices to have, but there are some things that you can change. So you can't change your age. So it is true that as you get older, your risk of getting cancer is higher. Also, for some types of cancer, if you're male or female, you have a more chance, as we talked about breast cancer,
right,
and men get prostate cancer. So yes, so that you can't change that about yourself. The other thing is genetics. Mm-hmm. There's some types of cancer that has a strong genetic component. For example, prostate cancer. Oh. Men that have a relative, father or brother, have more of a chance of getting prostate cancer. Okay. And when they are talking to their doctor, sometimes they will start with the screening sooner. Okay. Your race. African American men are more likely to get prostate cancer than white men. So when we see patients in clinic, we take that under consideration. So there are certain things about yourself that you can't change. You can't change that you're a male or female, and you can't change your race, and you can't change your age, unfortunately.
Those uncontrollable
factors.
Yes, yeah.
There are certain things. Yes, that's true. But having a healthy diet and
right,
exercising, and also, this brings up a good point. We're talking about screening. We encourage everybody to have a primary care physician. It's very, very important. Primary care physicians are absolutely critical for health. See them regularly, talk about your risk factors, talk about the practices in your life. They will make sure that you're a healthy weight, your blood pressure is under control, you're not at risk for diabetes, and then talk to you about the screening that's available. Maybe you have certain risk factors in your life, and talk to you about when you should start prostate screening, when you should start your mammograms, when you should start perhaps having colonoscopies. And it's just really wonderful to have a primary care physician. So for those of you who don't have a primary care physician, get one sooner rather than later. So if you have anything that comes up that you're worried about cancer-wise or any other health problems, so you have that established already. It's very, very important.
So get those screenings if you need them. And I think it's worth mentioning, talking about the controllable factors. You touched a lot on smoking, and in North Carolina, with lung cancer being our number one cancer death, I do think it's worth mentioning. And I was reading the other day that 80 to 90% of lung cancers could be prevented if you stop smoking, if someone was able to stop with cigarettes.
Yeah.
So.
And a long time ago, we did not know smoking would be such a serious health risk, and kind of everybody smoked.
Right.
And so now we know that that is a big cause for concern. So if you smoke, please take measures to explore how to quit. And if you have family members, loved ones, friends, encourage them to quit. It's never too late to quit smoking.
Absolutely. That's a great point. Well, thank you. Those are great questions, and thank you for providing us with more information. So that really does conclude our conversation today. I hope it was beneficial to all of you that were able to attend, and thank you so much for tuning in. We're excited to be back next month as well. We will be talking about eating well, nutrition, and cancer prevention, and the role that food can play with cancer. So that is July 27th at the same time, so we'll see you right here then. Trudy, thank you so much for being here today. You bring such a passion to what you talk about, and I really do love having you.
My pleasure. And working at the Cancer Center is like a true privilege, and we strive every day to help people through their diagnosis and their treatment. And we really hope that talking about some of these myths will ease some people's worry, and to definitely seek advice of their doctor if they're having any health concerns.
Yeah, thank you so much. Our patients are so lucky to have you. Well,
That
that is it for us today. Thank you so much for tuning in, and we will see you next time.